going to be the first of an event that I think we're going to have, and I know we're going to have every year, to highlight some of the challenges that surround the patients who are in the adolescent and young adult age group and facing the journey through cancer. This wasn't designed or intended to be a medical conference where we're talking about the biology of cancer or the approach to the treatment of cancer. What is the goal? What are we trying to accomplish? So the acronym AYA or AYAO stands for Adolescent Young Adult Oncology. How do we define that? Loosely, it's been defined as patients between the ages of 15 and 39 with a diagnosis of cancer. It may sound somewhat arbitrary, but it's defined in a bit based on fact. And that has to do with differences in changes or increases in survival rates and how there's a real gap in improvement in outcomes that we've observed in this age group. So the goal of the efforts that are developing around the country is to raise awareness of the healthcare institutions.
As an individual and a family that's looking for help, we found instantly that there were a lot of people who were there, compassionate, caring people that were willing to help us out, but where there really is a shortage is there's a shortage of time for everybody. Time becomes of the essence. The caseloads that the social workers carry, the healthcare providers carry, they have enormous caseloads, so as caring as they may be, they've only got so much time for you, and that's why it's so important if you are in this situation to form your own advocacy group. And one of the things that Rise Above It does now is that we work with families and patients who maybe don't have any kind of computer skills or they have minimal computer skills, just to help them get started.
Just to give you a little background on why I started this foundation. In the 3rd grade, I was diagnosed with Hodgkin's lymphoma. For me and my family, it was definitely a tough situation because we didn't know anything about cancer or anything of that nature. So my father actually quit his job and drove me to my treatments and my doctor's appointments.
My job with the army of folks that work with me is to educate not only candidates but members once they get elected. And when I tell you about advocacy and why it's important for a children's hospital to do that, it is because children don't vote.
Ohio sees about 60,000 new cases per year, or about 7 new cases every hour, every day, all year long. One of the things that I have been trying to be committed to is to ensure that our children receive health care coverage and receive the treatment, whether they're afflicted with cancer or some other disease or illness or an accident.
And I'm coming before you representing the interests of 345 faculty, physicians, scientists, PhDs, MDs, clinicians, researchers who are existent in this town interested in cancer. It is the largest single effort that we have in this town.
And you can see that there's this gap, there's this hole in the middle where young adults have not appreciated increases in survival rates compared to younger cohorts or older cohorts.
It's 2 headlines, and then we'll talk about them. The first headline reads as such: Incidence of cancer among adults and young adults is on the rise, yet outcomes are similar to the 1970s. And here's the second headline: Rise Above It. That's the inspiring message of strength from a young cancer patient whose mission is now carried on by his devoted brother and father. Which of these 2 headlines would get you to want to learn more?
As our technology environment continues to evolve, how young people's participation and engagement with the technology also continues to evolve as well.
How do you exploit social media to really drive change in our society? But when we're looking at it from a disease perspective, it opens up